Okay, very good. You had mentioned early on, you talked about related to our 10 cases here, you mentioned out-of-state travel. And the only reason I bring that up is because there sometimes is confusion about out-of-state travel because I, for example, I'm sure many other people go back and forth between Washington on a regular basis. So when you talk about out-of-state travel, can you talk a little bit more about what that means in your context?
Yeah, well, I'll use kind of the OHA sort of guidance is that if people are traveling out of state, not for work or school, so in other words, basically for vacation is kind of what they're getting at, then the recommendation is that when people get back that they quarantine for 10, 14 days. So that is a recommendation. I would say that if you're, if you are, it's a little trickier with us because Washington is right there. It's kind of our region. I don't know that would really, that's not what probably most people think about out of state travel. I think it's more like when you travel, spend the night, stay somewhere else for vacation type purposes. That's when because if you think about it, you're just, in this whole new mix, and maybe that particular area has a higher rate of COVID than where you're from. So just it might increase your possibility of getting the virus and then potentially bringing it back. So just, using good, and just using the good practices that you already have of wearing your mask and staying away and all that stuff when traveling, even if it is just across the river and going shopping, that's always good too.
Sure, yeah. So interesting. So it sounds like, though, that the cases that we've had in this past week have been, some of those, maybe majority of those, have been related to that out-of-state travel. And when the tracers have done their work, that's what they found?
Yep.
Okay. Interesting. Okay. I'm curious about, so our percentage positive rate, is very low, which is great. But I'm curious about the number of tests over time. So just thinking about how many tests have been happening over time, my assumption is, and maybe my assumption's wrong, but if you looked at a graph of those, the number of tests would be declining pretty rapidly. Is that an accurate assumption, or what are we looking at in terms of historical tests?
Yeah, well, you're absolutely right that the number of tests that are being performed now is lower than, say, in January or December. So there's fewer people who are symptomatic. There are fewer people who are close contacts. Also, you may recall that when there are outbreaks at long-term care facilities, during the course of an outbreak, staff have to be tested, there's rules, and sometimes it's staff and residents getting tested weekly. So that sort of drives the county's numbers up. And now most of the long-term care facilities are at their staff needing to be tested once a month. So there's still some screening going on, but not as much. So yes, tests are, again, they're going down, but still at a sufficient amount that we feel like, well, one, there's excellent availability, so that's always reassuring, and it's pretty easy to get a test if you want one. And then two, that because our test percentage positive rate is still very, very low, that an adequate, that we're screening enough people. If you're only getting 3 positives out of the 100 that you screen, you're screening a lot of people. So okay. But that's why it's an important number to watch. If we get to 50%, then we know, well, actually that would be really bad, but we definitely want to keep it below that 5%.
Right. Okay. You had some charts about the phase dates, and you had dates related to those, and I think that it showed, I try and remember, but it goes out into the June, maybe into the July time period.
Yes.
And I remember, and I'm trying to remember where I heard this, and it could have been on a call with the governor's office, I'm not sure, but I thought I heard that they were pretty confident that by sometime in May, all of those phases would be open up at this point, given the vaccine numbers that they were expecting. Have you heard that? Did I mishear that?
Well, I think that, so there's sort of a confluence of thoughts. Certainly President Biden said by May 1st, everyone's going to be eligible, which is fantastic, which we hope will be possible. OHA hasn't come out and said, absolutely, that's going to happen. Everything is going to get pushed back into a shortened time frame. So it's a tiny little bit of a wait and see. I think OHA is trying to be a little bit more cautious and sort of manage expectations, that it may take a little bit longer. And then recognizing that, you know, we've been prioritizing people all along, and especially these next, you know, group 6 and 7, we really want to make sure, you know, that they are not sort of, don't get, you know, washed over by the entire population, as, you know, especially those people. I mean, it's a lot of people with health conditions that put them at higher risk. So my thought is that in Oregon, we'll kind of continue this, although I agree that it probably, that timeline of July 1 for all Oregonians 16 and up to be eligible, that might get moved up, but at least in some way still prioritizing those higher risk groups and things like that, so we can really make sure that they are taken care of.
Yeah, okay. That's probably, you know, maybe I heard a federal number and then the state is doing their own. So those charts that you showed are the charts that we should expect at this point in time.
Right, those are today's charts. That's all I'm gonna say. We have a call at 1 or something, so okay. It might change.
And as we all know, things change on a daily basis, so, or more often. I just thought of another thing, just we've talked about it in the past, but I think it's typically called the take rate, basically the number of folks that are eligible and then how many of those people are actually saying, yes, I'll take the vaccine. Do we have any information on that, how that's looking in our county?
Right, well, it's a little tricky because for the general population just yet, because we haven't necessarily, we still don't know if people are still having a hard time getting the vaccine, so we can't say definitively. We definitely know, and I think I've talked about this a little bit before with some groups, like we do know that seniors, and especially seniors in long-term care facilities, the take rate was like above 90%. I mean, it was really tremendous. So we have kind of those organizations. We have medical organizations where it's anywhere between 80 to 85%. So kind of more akin to how people are with accepting the flu vaccine. So we have some of those things, but right now we're not able to do it for a general population, I would say, just because we can't confirm that everyone who has the chance has gotten it. I mean, we know it's not 100%. And one thing that I can't share that is, I think, really fantastic, that actually in Oregon, people coming back for their second dose, it's been phenomenal. It's like 96%. I mean, it's great. So those who are getting their first dose are definitely getting the message and are able to get their second dose. So, you know, I think hopefully it will continue to progress, and so we can get as many people who are eligible and able to get that vaccine do it. But yeah, the jury's out still a little bit on that.
Okay, thanks. You reminded me of another question that I forgot to write down on my list here, but if somebody has an option of either the Moderna or the Pfizer or the Johnson & Johnson, so 2 shots, 1 shot, any advice there? I mean, obviously there's a difference between 2 shots or 1. Personally, I want to opt for the 1 shot version, but what can you tell us about that if somebody actually has a choice to choose?
If you actually have a choice, take the first one that you can get. I mean, I don't know what to say. I think it's really, really important that that people understand that they're all incredibly effective. Now, there are some folks where it's going to be really hard for them to get a second dose. So if you're one of those people, you're traveling, doing whatever, yeah, it's probably way better to get the Johnson & Johnson one, because it is just 1 dose. And then, you know, because if you don't, it's a challenge, you know, if you go somewhere else, if there's going to be a 2-dose series. So I think in some circumstances that's a better one. But other than that, they've just been incredibly effective. So, you know, it's when we're still in this period of scarcity, it's hard to say, be a picky shopper. Yeah, I think the first one that you can get is, for the most part, the best bet.
Okay, good answer. So you mentioned growing season, and I was slightly confused by that for a bit. I think I know what you meant by that, but I'm assuming you're talking about basically the ag industry here and the migrant population coming in. And so I'm assuming so that would be my first question, but let me add on to that. So when we have a fairly large influx of people, you all did yeoman's work last year working with them, everybody did, to make sure that we kind of got through that season, because there was a lot of concern that maybe there would be some significant outbreaks during that time. And that didn't happen. So kudos to all of you for the work you did. What is the kind of the outlook going into this season? And particularly, I'm thinking about, is there going to be vaccination clinics for those folks? Because it may be, and I don't know if this is the case, but it may be that a lot of those folks may not have been vaccinated. So is there, what's the thought on all that?
Yeah, well, and this one, as you can envision, there are, of course, a lot of moving parts, because we have people coming from, either a different country or certainly from a different state or so. So there is, but like I said, a lot of the systems are built up already around that. So there's much better communication. And of course, Wasco County cherry season is so early that, or certainly by the time some of the statewide like toolkits and everything rolled around, there is, but like I said, a lot of the systems are built up already around that. But there is a lot more prep from the state, and there's also Wasco County cherry season is so early that Washington, by the time some of the statewide like toolkits and everything rolled around, there is, like I said, a lot of like things are built up already. Really, but there is a lot more prep from the state, and there's also they get here that if the vaccine is available, early that Washington. One dose night, another one they bring all your information, so they're out here making sure it's September, like vaccine, and then yes, really, but there is a lot. We look at it as a state, and there's also they get here that take as many people as safe as possible. So certain dose night, another one they bring all your information, so they're out here coming from somewhere else, but they not been vaccinated, and then and really vaccine. There is a lot. We look at it as a state, and there's Orchard is planning as many different types of clinics safe as possible. Clinics one by packing houses, so they're coming from packing houses, which we know are really high risk areas just because of the proximity of people. So you're absolutely right when I said growing season. Yeah, it's not really harvest doesn't happen until later, but just the whole thing, people coming in and folks already have begun arriving in the area. So we're trying to do a little bit of research to figure out where people are coming from and kind of what the uptake, what types of vaccines are given in that county and what the uptake has been. And then again, working with the growers, so we have a better sense of, kind of the work that needs to be done.
Okay, very good. Kind of what I was thinking, like more like towards harvest, where we have the peak of our population increase, and just wondering if so, and that's also the point in time which we're going to kind of be opening up to general population in terms of, okay, everybody can get vaccinated. That's at least my assumption. So you'll have this big opening for general population, and then you have an in-migration of thousands of people. And so I'm wondering if there's a case that we can make to OHA that if we need to vaccinate a large part of this new population coming in, if they will understand that we are going to need additional doses during that time.
Yeah, absolutely. That's such a great point. And I did bring that up on a call, and they have said that they will direct doses to places who are having, because they're very, very cognizant of this, who are having more seasonal workers come to the area. So you're absolutely right. Like, it's our population grows by 6,000. How can we deal with that? And so that's part of the plan.
Yeah, perfect. Okay. And obviously, as Commissioner Schwartz said, part of it is having the vaccine, the actual material, and part of it is having the people and the setup to do that. So I think, and you all are obviously going to work on that just like you did last year. So that's going to be great. Kathy, you had a question?
Yeah, I just wanted to make a comment that, despite the, as you mentioned, Herculean efforts of the community around harvest, there really were multiple workplace outbreaks amongst the packing houses and the orchards. And just to remind folks that the Latinx population was disproportionately affected by COVID. And so I just wanted to clarify that a bit. So yeah, so thank you.
Yep. I think from my perspective, I had concerns that it would be much, much worse than it actually was. So I was very happy with all of the work that everyone did to protect everybody. So, okay, my final question, and I'm sorry I have so many questions today. It's kind of a big picture question, and it's really about lessons learned. So, and I know this is probably a little early to think about this, but I'm wondering, like, both locally and even more so maybe on a worldwide standpoint, what kind of lessons have we learned like throughout this extremely, unbelievable, unprecedented situation, that going forward, can we avoid this in the future? This whole, what we've just experienced or are still experiencing, but is there a way we can avoid this going forward, or is this going to be more commonplace going forward in our world?
Well, I certainly don't have all the answers to that, but I think there are lots of lessons learned, and on all, the micro level all the way up to the macro worldwide level. I mean, I think that, internationally there were groups to look out for pandemics, and the funding for those groups were cut. So don't do that. Make sure that we continue to keep, that robust scientific community funded, and not everything that we pay for has to generate money. And so I think kind of keeping that, this is a shout out to science as a whole, but that it is really important. And sometimes it's just not always inherently obvious why some programs might be really important, but I think kind of that. And then, but I would say also, I think that there were especially in the US, we could have done a better job of kind of looking at some of other countries who have just done a better job. I mean, I think the wearing masks in other countries was already kind of culturally a much more done thing, and we were way slow. And I say we, I mean like the whole scientific community too. I am embarrassed to say, but I certainly scoffed. I'm like, how's a cloth mask gonna help anyone? I mean, this was, I was used to surgical masks and what they're used for. So we probably could have done a better job right off the bat from like recognizing, oh, we should have learned from these other countries, and taken that knowledge. And then just, I think well, I won't go into it too much, but I think trying to get across something, the challenge of getting across things that are nuanced, it's hard, and to bring people along, kind of meet them where they're at, and then try and bringing folks along is really important. So a lot of this is just the way we are. We don't like those top-down messages, but so to really kind of speak to what's important in people's lives and try and it's sort of called motivational interviewing is a much more effective way to get people to either be open to understanding, so kind of going into things with a lot more humility and understanding instead of you must do this, don't you know, blah blah blah. So but anyway, those are kind of local levels. But I think, yeah, there's just so many. I will stop now because I could go on and on.
No, that's fine. I just, it's really just the idea is, really, I think everybody would agree this was not one of our best historical years. And I would have to guess most people would hope we can go back to quote normal, and that we can hopefully not have to deal with this again. And there may be some, ways we can do things going forward. So anyway, that's enough blabbering for me. Thanks for my questions. Commissioner Kramer?
Yeah, we received a letter yesterday that's being circulated from the Eastern Oregon counties, and hopefully each of you have had an opportunity to see it. But my question from that letter is asking for the governor and Oregon Health Authority to give local control. So my question would be to Dr. McDonald and Interim Director Campbell. Is North Central Public Health District ready for local control?
So control of what? I just want to be clear that I understand. There's lots of things I'd like to be in charge of, but you're probably thinking of something more specific.
So this is all about the COVID and the executive orders and everything that we're dealing with right now. And you just mentioned the top down, and so is it time for top down to relinquish and allow local to deal with local issues? Or you've stated that throughout your presentation today, about how we're doing and what we're doing. And so my question on that is so that I can ask my colleagues later on in the meeting, do we want to consider signing on to this letter? Do we want to experiment some more? Do we want, so I guess it's a broad question to you, Mimi, but it's, is public health consider, are we ready to take local control of the situation?
Well, that you did just pop that in on me, Commissioner Kramer. I will be honest, I hadn't, kind of with all the things that are going on, I haven't thought about that in specific. So I don't want to give an answer.
Okay.
I mean, are there, so I would have to kind of look at the letter too. Would I like more, some more local control? Yes. But I don't know that that means kind of throwing everything out from the state, because we rely on them a lot for some of the guidance, which just locally we don't have time to, or the knowledge base to develop. So if it were a sort of a cafeteria thing, maybe I could do it and pick and choose. I don't know if that's the way that it works, but so I think it's, something to think about. But I would definitely need a lot more information to make a real statement right now.
Thank you for that, because that's the same boat that I'm in. I'm looking for more information. So thank you very much.
All right. So we do have, Mimi, there was a few questions in the chat. So maybe we could address those. And if anybody has any questions after that, we'll open it up. Can't believe we filled almost an hour again, but.
Let's see. So Roger Nichols, where can people go to get tested these days and who should be tested? Thank you so much. It's a great question. So where can you go? Certainly, we always ask people's first stop to be their primary care provider. However, we also have testing here at North Central Public Health District 5 days a week. So if you don't have a primary care provider, it's too hard to get through, you can always call us. Who should be tested? This is, I still would highly recommend anyone with any kind of symptoms, even if you still think it's just a cold, call your primary care provider, call NCPHD. We would be happy to do a test. As Commissioner Hagee was talking about, we want to make sure that we're testing enough people. So just because it's not, you want to keep it on the front of mind. And I know my colleagues in the clinics have been keeping it at the forefront and continue to test people. So certainly, again, anyone with any type of symptoms, even if it's just sort of upper respiratory or a fever, cough, chills, headache, nausea, vomiting, diarrhea, anything like that, that's a reason to get tested. And then of course, if you come into close contact with someone who is a known case or a presumptive case, you absolutely want to get tested then too.
And there was one more question that just jumped in there.
Oh yes, who needs to quarantine? Whew, that's a great question. So the easy answer is if people have been exposed to someone. So in other words, if they are a close contact, then they would need to quarantine. And then there's a couple of different ways that it can go. They can either quarantine, so again, remain apart from others, either for 14 days, or is the sort of gold standard. People can, and again, this means, that you're not developing any symptoms after 14 days. You can go back to what you're doing. 10 days without any symptoms is acceptable. What's that? What was that, Commissioner Hagee? Cat, dog? Sorry. So 14 days gold standard, 10 days acceptable, or also no symptoms, 7 days with a negative test on days 5, 6, or 7. And then also paying attention and making sure you're not developing symptoms in those times. Now, there's also the added recommendation that if people travel, as I mentioned, outside of work and school for other reasons, they go out of state and then they come back, same requests for quarantine. That's definitely not a mandate. It's more of a guideline. So I hope that helps. Is it the same for people who have vaccines? Thank you for asking that question. So that's a great one. And because the recommendation are, if you've been exposed to someone with COVID-19 and you're fully vaccinated, you're 2 weeks out, that you don't have to isolate or quarantine, If you have been fully vaccinated and you're 2 weeks out from your vaccine and then you go travel, no, you do not need to quarantine when you come back. So great question. Same thing, if you're close contact to someone and you've been vaccinated, you don't need to isolate or quarantine. Always important to look for symptoms, but thank you for asking that.
All right. Thank you very much. Thanks for the questions. Is there anybody else before we go from this? I have one thing that I'm going to add to the end for maybe next time, but anybody else have any other questions?
I do.
Okay. Who is this?
This is Jeannie Adams, and I hold seat 1 on the City Council on Antelope. And also we have another member here, Rodney Shank, seat 2. Anyway, my question is, I'm sorry we got in late on this. Young Life, are there clinics being set up down there? You know, it's very difficult for us over here in the southern part of the county, and we're kind of neglected from everybody. But my question is, do we have any clinics set up in this area at all for people to get shot?
We haven't, but that doesn't mean that we can't. One of our challenges is sometimes reaching out to people to get that. So I'm trying to think of the best way to get information, because we absolutely, one of the things that we want to do is to go and do out clinics, and I'll talk with our team, and so my wheels are already spinning about how we can get information about that and how we can make that happen. So thank you so much for bringing that up.
Right here in Antelope, we have probably 20 people that are aged and disabled.
Okay. So, what I'm just going to ask right now, because you're here, what would be the best way to get in contact? Or actually, you can, would you mind calling the health department number? And then if you leave your information, I will get back to you, and you can help me plan, because that would be great.
Alrighty, I'll do that.
Thank you so much.
Thanks for joining us, Jeannie. Would that be 506-2600? Was that the number?
That is correct. Thank you.
Okay.
Nicely done.
Yes. Okay, so what I was going to ask you, maybe for next time, but I know at Wasco County, there's a lot of discussion going on about the idea of coming back to work. You know, what does that look like? How should we do that? What's the proper way to do that? So maybe that's something we can talk about at a meeting going down the road, but it's certainly before us. Yep. And I'm sure it's not just before us. There's other people that maybe have been working more remotely, and now they're getting back into a mode where we can potentially get back into a workplace situation. And how do we best do that? So for a future time.
And then there's just one other question in the chat box from Ms. Morales. Follow-up question: vaccine people that have symptoms. We ask if people are having symptoms that they not receive their vaccine at that moment, that they wait until they're better and then they reschedule and get their vaccine.
All right. Well, again, as always, and there was a comment in here from Debbie saying how wonderful you all are and how great work you've been doing. So kudos to you again. Thank you for coming today. Thank you for providing all this information. Thank you for answering the questions. And we look forward to seeing you again in the future. And thanks again for the work that you guys are doing.
All right. Thanks very much. Have a great day, everyone.
All right.
Yeah,
bye-bye.
Great. Thank you.
All right. So we are going to move on. We are going to actually recess from our regular meeting here. We're going to go into our district meetings. We have a little bit of work to do with both the library district and our extension service district. And we'll go ahead and first go into our library, Wasco County Library Service District. And we'll kind of open up that district meeting. And we have a couple things to deal with. The first one is our budget appointment.
Commissioner, before you do that, I need to note 2 of our commissioners found an error in both the orders for the budget appointment. In the title of each appointment, it has Ken Pauline when it's supposed to be Frank K. So I just want to make note of that. I've corrected it, and the one that gets signed will be correct. But I just wanted to make note of that. These budget appointments for both of the districts are following suit. Frank K was appointed as a Wasco County on the Wasco County Budget Committee, and that committee serves as the budget committee for both of these districts. And so this is just formalizing their appointments to each of the districts.
Very good. Thanks, Kathy, for that update. All right, so we do have a proposed budget committee appointment, and Does anybody have any questions, or do you have a motion perhaps?
Mr. Chair, I'll move to approve Order 21008, appointing Frank K. to the Wasco County Library Service District Budget Committee.
I'll second.
All right, we have a motion and a second. Any discussion? All those in favor say aye.
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 Chair votes yes. And as Kathy mentioned, it's actually Frank K., not Kim Pauline. So, all right. And then additionally, we have a set of minutes that from the last meeting that we had on the Library Service District from December 16th. Did everyone get a chance to look at those over? And are there any questions, changes, or do you have a motion?
Mr. Chair, move to approve the December 16, 2020 minutes of the Library Service District as presented.
I will second.
All right, we have a motion and a second. Thank you. Any discussion? All those in favor say aye.
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 Chair votes yes. And I don't believe there's anything else in the Library Service District we need to do. And I don't believe there's anybody from the Library Service District here. Okay.
No,
So with that-
I let them off the hook this morning. I told them they could come if they wanted to, but this is all housekeeping.
Okay. So with that, we will go ahead and conclude our Library Service District meeting, and we will move to our Wasco County 4-H and Extension Service District agenda. The first of which is, just like before, an appointment of our Budget Committee person.
Okay, Mr. Chair, I'll move to approve Order 21-009, appointing Frank K. to the Wasco County 4-H and Extension Service District Budget Committee.
I'll second that. Thank you.
Very good. We have a motion and a second. Any discussion? All those in favor say aye.
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 Chair votes yes. All right. Very good. Welcome, Frank, to that one. All right. And we have some minutes again from December 16th for the Extension District.
Okay, I guess I'll move to approve the December 16, 2020 minutes of the 4-H and Extension Service District.
I'll second.
All right. We have a motion and a second. Any discussion? All those in favor say aye.
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 Chair votes yes. All right, so that passes well. And with that, we conclude our Extension District meeting as well, and we will return to our regular session. We're just about on time again, and we will go ahead and go to the next item, which is our Wasco County owned land policy revisions. Jill Amory and Kristen Campbell, you have some information for us.
We do. Good morning. Thank you, Chair Hagee, Commissioners. Jill Amory, your assessor and tax collector for Wasco County. And bear with me as I have way too many screens going this morning. So I come before you for consideration of an update to the Wasco County owned land policy. To give you a little bit of background, Wasco County approved our first policy for the Wasco County owned lands in 2016. The policy addresses how lands that we have either acquired through property tax foreclosure, purchase, or other means are processed out of county ownership. It is a priority to get these properties into ownership other than the county, preferably back onto the tax roll or serving a higher purpose. So currently, Oregon revised statute allows the county to transfer properties to other governmental agencies and qualifying nonprofits for low-income housing, social services, and childcare services. However, with the current housing situation, it was requested that we bring to the forefront the option to relinquish title to a property for low-income housing if the board finds it in the best interest of the community. And this policy update addresses the authority and the goals for such action. And I won't read through the actual policies, but would entertain questions regarding the two updates to the two sections. I do, however, want to provide a little bit more background. So we adopted the policy in 2016. We've had auctions and sales in 2017, 18, and 19. And in those three auctions, we have raised nearly $600,000. And currently, those proceeds are distributed back to the districts. Now, there is currently a case pending in the courts that may challenge this and may change how that works. But I do want to be sure as we're looking at the policy update that we are adhering to the fairness, equity, and transparency in those processes. And that we do currently have, you as the board currently do have the authority to relinquish title to all three of those, and also municipal and other government agencies. And that there is currently a lot of competition and need for the limited resources that we have. So I think there's probably much to be considered. And I know that I still have some questions, and in conversations that I've had, even just since pulling this together, working with Commissioner Schwartz, working with County Counsel Kristen, and some of the general conversations of how it impacts the districts with the funds being distributed, and how we really put into place a good, fair, equitable, and transparent process for all of the organizations that we already potentially have to get these properties in other hands to serve that higher purpose. And with that, I would entertain any questions that you might have.
All right, questions for either Jill or Kristen?
I don't have questions right now, but I do have a couple comments. First, we do have Joel Madsen from our Housing Authority here today, and I just wanted to recognize that if we wanted to entertain any comments from him. But as chair of the Mid-Columbia Housing Authority, this has come to my attention, and I think that our housing shortage in Wasco County is just intersecting so much of what we're trying to do in this community. And I think it's just really important that any kind of help that Wasco County can give to this situation, we should give consideration to. So to give you some examples, I think that we talk a lot. We have some workforce development issues. We have an acute need for mental health workers in this county. And I think folks are really struggling to find affordable housing. We talk a lot about economic development. We've got solar projects, possibly data centers being built, and there's no place for people to move into. And it is really it is a crisis. Just yesterday, I was at a community action board meeting, and we're entertaining having an AmeriCorps volunteer come into our community to help with the homeless situation. And the biggest barrier to actually getting that is that the AmeriCorps person will likely not be able to find housing in this county that they can afford. And AmeriCorps is kind of a special program in that we cannot supplement that housing at all. That's part of their philosophy. They need to be living in low income housing, and so we can't help with that necessarily. So there are just some barriers that we are seeing in this county. It's real, and it's all over. People looking for affordable housing on social media every day. I'm seeing that, and people struggling. So I would hope that we could give this policy some consideration. It is a policy, so I think that it is something that we can continue to work on. But I really thank Jill and Kristen for putting this forward for us to consider today. So thank you. I think that's right now all I have. So yeah, thank you. And I wonder if we could entertain Mr. Madsen's comments. He's seen the policy. And
Sure. Joel, you're here with us. If you have anything you want to add to this conversation, now's a good time to do it. Welcome.
Thank you, Chair Hagee and commissioners. Thank you for the opportunity to chime in on this policy. And as you'll recall, when I came before the commission a couple of months ago, this was one of those policy recommendations that I did offer up as part of, what could Wasco County do to help in the challenge and crises, frankly, that we have around affordable housing. Land is arguably the biggest piece of the puzzle when we work to actually produce affordable homes for county residents. And this policy moves us a step closer to being able to work closely with Wasco County, find those opportunities, and be able to then produce affordable homes, whether that's home ownership or even potentially affordable rental. There's a couple points in the policy. So again, thank you for taking the time to bring this forward and to be contemplating the prioritization, as I see it in this policy, for leveraging those Wasco County surplus properties, publicly owned properties for affordable housing production. There's a couple just points in the policy that I want to raise. It does acknowledge that there's an existing Wasco County owned land committee. So it's a review group. And I just wanted to offer up your county's housing authority to be involved in those discussions around what lands could potentially be viable for affordable housing developments. And I've appreciated those discussions with Jill and the assessor here at Wasco County to already have some of those discussions. I also wanted to zero in on the element and requirement for deed restriction as part of this policy, and that's actually statutorily required. And that is consistent with what we do when we leverage other public and private financing. We are often negotiating those deed restrictions that appease the other lenders and the other folks that we're pulling to the table to help develop affordable housing. The land piece of this is one piece of that puzzle. We still need to obtain the financing to make sure that we can develop the affordable homes and maintain them as affordable homes over the long haul. So I would encourage that the policy remains specific to that restrictive covenant and deed restriction, not necessarily impose additional requirements. Obviously, that's a policy discussion and decision of the board. Just my perspective that sometimes there needs to be that negotiation of what's actually in that reversionary clause and deed restriction itself. My other comment is around the focus of this policy to be able to relinquish the title for no less than the amount of tax foregone due to the foreclosures and fees and expenses. I fully understand and recognize the need for obtaining and maintaining the tax revenues. I want to raise the issue of the more that an affordable housing developer has to pay for the land, the less likely it is that the product's going to be affordable over the long haul, or the more likely that we have to raise other capital to help make that affordable. So this policy is asserting an opportunity, but also a challenge for us to be able to have that resource to be able to actually pay for the public land to turn it into affordable housing. Thank you very much for contemplating this policy and having this before you. Also, thank you for letting me provide my comments here this morning.
Thank you for being here. Thank you for the work you do. Any questions for Joel or from anybody, including Jill or Kristen?
I would ask Joel, are you recommending some language in the policy that actually has the housing authority as part of the Wasco County owned land committee, or some kind of language that includes the housing authority in those discussions? Is that what you're asking for, or?
So I don't know who's on the Wasco County Land Committee. It certainly would be of interest for us if there is a place where we could provide our expertise to the county to at least identify those potential opportunities for land. So if there's a defining policy or structure to that land committee, I'd welcome the opportunity to participate in that. I think our organization would be interested in doing so.
I can respond to that and shed some light if you would like. It's a good representation across the departments of Wasco County that would have either insight as to that parcel, maybe use of that parcel. So it's our surveyor, our director for the road department, our director for planning. We also have public safety on there, myself. So it's a pretty diverse group. And I would actually suggest, and I know that we're looking at the housing situation, but the ordinance really does address already low-income housing, social services, and childcare services. And that if we were going to consider having a housing authority as part of that committee, that we would also be, again, fair, equitable, and transparent, and also allow those social service entities and those childcare service entities to also participate and be part of that for, again, fairness, equity, and transparency.
Yeah, that makes sense, Jill. Thank you for that. Okay, so I don't really have any more questions right this second, but maybe Chair Hagee or Commissioner Kramer do.
Perhaps. Commissioner Kramer?
Yeah, with what we've just heard from Mr. Mattson, is this, does this policy need more work, or are we confident that that we're covered within all of the rights and regulations that we need to deal with? That'd be for Jill or for Kristen.
Yeah, I'm happy to respond to that, Steve. I would suggest that there is more work that needs to be done even before our discussions. A lot of questions have come up, and I think one of the entities that we haven't heard from would be the districts, and how that might impact them on what we do with the sale of the proceeds, as well as the other social service and childcare service industries.
Yeah, I wouldn't disagree with that, Jill. I think that's, yeah, but I think this is a really good start. It gives us something to think about, and, you know, certainly that discussion with districts definitely should include, I'm sure they will bring up the fact that they're, you know, people they're trying to recruit to the area are really struggling with housing as well. So yeah, I think we can take it back to the drawing board and come back. Work in progress.
Yeah, I agree, Commissioner Schwartz. I think it's a great start. I think this is great conversation, but we definitely still have some work to do. And again, I don't know, Kristen, I saw the email, but again, there is a case pending that may really have an impact on how we deal with these properties. And I'm not sure, do you have any insight as to how long you think that that might go on before we have a decision?
It's an issue of first impression with a lot of interest. It's still fairly preliminary. I would anticipate a matter of years before there's a final resolution.
I'm not really aware of what you're talking about, so sorry. Can you expound a little bit about a case that you're referring to?
There's been a class action filed in the Oregon courts naming all the counties. Basically, it's challenging the statutory scheme regarding the excess in the excess revenues realized as a result of tax foreclosures.
Oh, okay. Okay, I remember that now. Thank you. That came up quite a while ago.
Yeah.
Okay. So any closing comments, Joel? Is that okay, Chair Hagee, if I ask him?
Well, I was going to add a couple questions. And I was going to ask about that because I remember the issue outstanding of when you have a foreclosed property that sells for higher than what are outstanding, there's really a net profit on it. Are we engaged in that lawsuit in some way, or is it?
We are a party. The counties have joined in the defense and are sharing the cost of having one unified defense represented by a law firm in Portland.
Okay, perfect. That was my question. And then the other ones was going to be, this was more a hypothetical issue, and it was all relationship to the other districts. You know, if the county, for example, would just kept moving all this property, and maybe let me ask a question. This relinquishing the title is kind of transferring it. Is that correct, Jill? And I mean, we're not asking for payment for it. It would just be moved over to another agency that would use it in a housing situation. So there's no money coming in to pay for that, the outstanding taxes.
So you're correct. ORS does not define that, but that has always been a goal of Wasco County and most organizations of when we setting the minimum bid requirement for auction, private sale, or any of those transfers. A lot of the counties will indeed try to make the district whole for those taxes that they essentially lost when they were foreclosed upon.
So in this case, does this policy, as it's proposed right here, would it require, when the title was transferred, would there be an exchange of resources?
It does leave that discretion currently with the update up to the board,
Okay.
with that being the goal.
Okay. Yeah, the hypothetical I was thinking of, if you had a county commission that was just given property away right and left, the districts might not support that.
Right.
Yeah.
And I think
Okay.
that's a real question I have with not hearing from them of.
Yeah. Okay. And the other thing was just thinking about, I was actually thinking about this in the context, sometimes we foreclose on actual houses and structures. But it seems like, at least the time that I've been around and the time we've done this, those houses and structures have really not been very habitable for the most part. There's been a couple that have, but most of them have been really in tough shape. Not something I think a housing authority would want to take into their inventory and try to rehab. I didn't think of the land, but it'd be curious to look back at what we've had to see if there's really anything of interest, anything that would be helpful in that regard. A lot of times we end up with slivers of property or a little thing here or there that really only makes sense for the neighbor to buy it because it's so. But it's a good idea if there is property that makes sense, that certainly could be considered. I just was commenting on that, Joel, just so we don't have a lot of like nice 10-acre pieces of property that we foreclosed on that are greenfield sites for something. I haven't seen that yet.
Joel is, I believe, if I may, Joel is intimately aware because we have had several conversations through the years. And you're right, Scott, we don't take properties that are easy for reuse. And I know one year in particular, I reached out to Joel because we had some lots down in the most southern part of the county that we literally couldn't give away. They didn't sell at auction. And so I called Joel and said, hey, is this something, do you have the need that far south? So we had that discussion and we've had several. And for instance, this year, the only property we took was a 20 by 20 parcel in the middle of a rural field that someone else owns. So oftentimes they're strange, they are really unique. And as you said, they are not in the best of shape. So we have had conversations for many years.
So anyway, Joel, I think that, but yeah.
Chair Hagee, if I may, just in my closing remarks quickly, is that actually, I am looking at that list right now and I'm excited about 3 to 4 pieces of property. And so this is not an issue where it's going to be every piece of property is going to go for affordable housing. What we're doing is we're creating a clearer path forward for when that opportunity comes up. Right. And you're going to have this policy in place that you can lean on to help Wasco County invest in solutions for affordable housing. We've talked before, and there are very few things you can do as a county to actually facilitate and support affordable housing development. This is one example of having that policy in your toolbox for when the right opportunity comes. It doesn't force every property to go to affordable housing. It creates a path for when that opportunity is before you all.
Yep. Understand. Very good. All right. All right. So it sounds like those lots, by the way, were down in Shantico. So if I remember correctly, we had quite a few lots in Shantico.
They did finally end up selling.
Yes, they did. All right. I think we're going to go ahead and close this topic out. Thanks for being here, Joel. We have some more work to do. I think we'll see it coming back again. But good work on this. I think it's a good direction we're headed, and look forward to seeing kind of a better, more complete version in the future.
Yeah, thank you for all of your questions and input today. We'll get to more work.
All right, and thank you for both your and Kristen's work on this as well as Kathy's. All right, with that, we are just a couple minutes behind schedule. Kayla is with us. She has a couple items: surplus vehicle requests and the status of our Munis conversion update. Welcome, Kayla.
Hi, thank you, Chair. Good morning, Commissioners. It's my first time presenting to you, I think, since we moved to this format, so bear with me. So the first item in front of you is the vehicle surplus order. Mike Middleton convened the vehicle committee earlier this year, which, as you know, is comprised of members from all of the departments around the county, with the exception of the Sheriff's Office and Public Works. They collectively determine which vehicles should be surplused, as well as prioritize the purchase of new vehicles, which you recently approved and we have received. So this request is just to formalize which vehicles will go to surplus, likely at the auction sales company auction on April 17th. I'm happy to answer any questions about the vehicles that are on the list. There's 5. These again are all older vehicles, higher mileage, higher maintenance cost, that have since been either replaced by a rotated sheriff's office vehicle or a new vehicle. So if there's any questions, I'm happy to answer. Otherwise, we are looking for a motion.
All right, any questions for Kayla? I did have a quick question, and maybe I missed it, but what's the idea for dispersing these vehicles?
What do you mean dispersing?
Well, getting rid of them. How are we going to sell them?
So they'll go to auction sales company.
Okay,
so yeah, we were pretty effective there last year. I think we sent 7 vehicles, all of which sold.
Okay,
So,
and that's in April, is that correct? The
yes.
next auction? Okay.
Mhm.
Questions for Kayla on this? If not, do we have a motion?
Sure. I will move to approve Order 21-011, surplusing 5 Wasco County vehicles no longer in use.
Second motion.
All right, we have a motion, a second, to declare excess surplus 5 vehicles for Wasco County. That's a good thing. Sometimes I look at our insurance numbers and I see the number of vehicles we have and the number of employees we have, and I sometimes wonder why that's the case. And there's reasons for it, but it's nice to get rid of vehicles that we don't necessarily need and put them back into better use. So any discussion on the motion? All those in favor say aye.
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 Chair votes yes. All right, you got it, Kayla.
Wonderful. We'll get rid of those vehicles. So the next item is an update on Munis implementation. So in June of last year, we entered into a 3-year, $350,000 agreement to procure and implement the ERP software known as Munis. This is considered an upgrade from our antiquated financial software, Eden, which I'm sure Commissioner Kramer and Heggie, you are intimately aware of the difficulties we have with that piece of software. So we've been hard at work. All the finance staff has been working and meeting weekly with software consultants from Tyler Tech since we kicked off last June. So I just wanted to give you an update of where the project stands right now. So you can see in the packet what we've done so far, and you can kind of see in the graph below, since we kicked off in June of last year, we have configured all of the financial modules. So all of our AP, purchasing, the GL, AR, and projects. So everything is configured. What we are now in the middle of is loading all of the data. So we've loaded vendors, we're working on loading invoice data, purchase order data, and then budget from the past several years. So the initial vendor data conversion is still in process. So there's a couple different parts to what we do. We configure what you would consider, I guess, what's the word I want? We can we have to get all of the data loaded into, now that we've determined what the what is the word I want? Goodness gracious. So anyway, we'll move on. The good news that we kicked off in June is kind of early in the pandemic, and at that time Tyler Tech determined that they would not be having any consultants travel. So you can see in the budget, we have not spent anything on travel as expected. We had budgeted up to $38,000, but no one has traveled here. And as such, because they're not on site, we're only being billed for the hours spent with the consultants. And because they're not traveling here and here for 4 to 5 days at a time, we've been billed probably, I would say we're at like half of what the services cost we expected to be. So wonderful news there. We're well under budget and still on time. So the project timeline, we're going to go live July 1st with financials. So that's everything I mentioned before, the AP, purchasing, GL, budget, so on and so forth. And then there's some reporting we have to go back and configure related to content manager. So Munis is much different from Eden in the way that it stores documents. There's a separate program that will allow us to attach contracts, any type of supporting documentation, anything related to employee data in a separate system that will work with Munis to display information as we need it, as opposed to having to store documents in several different places. So that configuration will kind of come later after July, as well as the CAFR statement builder that we also procured. So that will be configured after we go live with financials. And as we progress through the first fiscal year in the software, it will allow us to map to that statement builder so that at the end of fiscal year 22, Mike doesn't have to go back and compile all of the data separately. It actually will help us build those statements more quickly and efficiently. And then the last phase will be human capital management. So that will go live January 1st, and that is payroll, HR, recruiting, and employee performance management. HR and employee management is not really something we're currently doing in Eden. It's all a lot of paper processes. You know, if you want to change a dependent, if you want to get additional benefits, there's paper forms everywhere that you have to complete and bring to the office, as opposed to being able to complete it in the software. So that will be configured the later part of this year after we go live with financials. And then lastly, our next steps, we had to implement Adfs. It's an upgraded Active Directory that will work with Munis. And so Andrew and the IS team have been working hard to get that configured for us so that we can manage users internally, much like we do with Eden right now. And then there's more data conversion. We will go into testing in May, and then we will begin training in June for all employees that will be using the Munis financial software, which is department heads, our AP kind of clerks in the departments that enter invoices, things like that. Broader training will come once we implement the human capital management functionality. So that will come probably towards the end of the calendar year or early January. We do have what they call go live support starting in July. So we cut over on July 1, and then we'll have basically around the clock support while we go live in July. And that's about it. It's very exciting. We're on time. We're well under budget. And we've been really, really impressed with the Tyler Tech staff. This has been a very smooth conversion so far, but check back in July when we go live and things start exploding. Do you have any questions about it? Yeah.
All right, so you got a project that's on schedule or maybe ahead of schedule and under budget. That's pretty good. That's what we want.
Yeah.
All right.
A silver lining from the pandemic is
there you go.
Travel piece.
Questions for Kayla?
Just a comment, you know, I think that, yeah, it is a silver lining, but it also should kind of talk, you know, earlier we were talking about lessons learned. I think maybe we need to do harder negotiations in the future for these kinds of things and whether or not we need people on site. And because that's a chunk of change that was budgeted for. So just a thought. So, and it's nice to see you, Kayla.
And if I remember correctly, I think Tyler actually negotiated pretty hard and actually saved quite a bit of money in the initial negotiations from where we started.
Yeah, I do believe initially we were looking at closer to $500,000 to get this implementation completed, and so far we've spent about 60 of that. So good news all around.
Hey, I did have a couple, weren't really questions. It was just, there's a lot of acronyms in here. I think I figured out HCM is the human capital management. That's basically HR, human resources stuff. That's what that is, right?
And payroll There's this thing called employee self-service, which is similar to the web portal that Eden attaches to. I just saw Nicole's comment, HR stuff, yes. But this employee self-service is probably the piece that we're most excited about. It will allow all of those paper forms that employees currently have to complete to be completed online, including performance evaluations, where we're trying to get those into the system as well. So you don't have to send a piece of paper off and do all that. So
that's great. And then TCM and CAFR, I haven't figured those out.
Yeah, so Tyler Content Manager is TCM. And again, that's where we'll store documents. And it's actually a pretty robust piece of software. It can read documents and then sort of relay that data into the system so that we're not having to hand key, okay, this is the invoice number, or this is what this piece of data in the document means. So it's really more of a mapping software. And then CAFR is the Consolidated Annual Financial Report. So annual statement. Currently, and you know, I don't want to speak for Mike, but he gets to spend several days, several hours in Excel trying to compile data from all over Eden. Whereas this will enable him to not necessarily just click a button, but it will pull the information from all the places for him and help to set those statements up instead of, you know, manually doing it in Excel.
Okay, cool. And two more I had was ADFS.
So I might get this one wrong. This is a very IT term. So it's Active Directory Federated Services, I believe.
Okay.
It's a standardized, yeah, it's a standardized Active Directory functionality. So I believe currently we do use Active Directory, but there's some components in our environment that needed to be updated and joined together somehow. And then once that happens, it's a more secure, more efficient way to manage users and people that are in our Active Directory.
Okay, cool. And I probably don't need to know any of this stuff, but I guess I'm just curious. And how about the last one was UAT?
That is User Acceptance Testing.
Okay.
So that is, we'll probably pull in some folks from outside the finance department just to go in and test and make sure that the data that they're seeing makes sense, that the processes are set up correctly. We do an extensive amount of that before we go live, just to make sure we can work out as many of the kinks as possible before we start using the software.
Excellent. All right. Well, that was all I had. This is really helpful. It's exciting that you've made so much progress. It's exciting where we're headed. I think everybody's looking forward to a system that is not Eden anymore.
As is our whole team.
Yes. Yeah.
I'll probably come back maybe after go live, maybe sometime in July, and just let you know how we're doing with the financials once they've been turned on, and get some feedback from you.
All right. Looking forward to that with no blow-ups. And no other questions for Kelly before we let her go? All right. Thanks for being here, Kayla. Nice to see you, as Kathy said, and have a great day.
You as well. Thank you, commissioners.
All right. All right. With that, I'm going to, we are right on schedule to do our salary survey, but before we do that, I'm going to jump back. Sorry, Shelley, just 1 minute. Debbie's been waiting patiently, and she was up. She had a subcontract up in the discussion item, or discussion items, and I just wanted to, I don't think this is a long item, so maybe we can get this dispatched and let Debbie kind of be on her way if she needs to go.
Yeah, I don't know about patiently.
Okay, that's fine. So the floor is yours. We have a proposed subcontract here, which actually relates to the public health district as well. So there you go. Go ahead, Debbie.
Okay, my understanding that this is Kathy Clark, where are you? That this was just some, I guess the MOU changed or all this between Kristen and public health. So I think this is the most up-to-date version, and you guys are gonna take a look at it again. Kathy, help me out as far as what the need is on this.
Okay, so in December, and there's a memo in your packet, commissioners, and in December, Debbie brought forward a MOU with NCPHD, but after that was reviewed and approved by the board, there was some discussion with Oregon Health Authority about the language not being robust enough. And as it got worked through between North Central Public Health District and the state, they developed really was an entirely new, it's not an addendum to the old contract. So we are abandoning the MOU and replacing it with the subcontract that's in your packet, and it supersedes the contract. And there's language in there that in your motion, I believe, that indicates that it supersedes the previous contract. So really, you've already seen this.
Yeah.
You've already approved it. This is just crossing the T's and dotting the I's.
Okay, very good. Any questions on this, commissioners, for Debbie or Kathy? And if not, do we have a motion?
Yeah, Mr. Chair, I'll move to approve the overdose prevention subcontract between North Central Public Health District and Wasco County for overdose prevention efforts in Wasco, Sherman, and Gillum counties, and further move that this subcontract supersedes the memorandum of understanding regarding this work and approved on December 2nd, 2020.
I'll second.
All right, we have a motion and a second. Any discussion? All those in favor say aye.
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 Chair votes yes. All right, Debbie, we got it done. All right, with that, what's that?
Thank you very much.
You're welcome. All right, we will jump back to the North Central Public Health District salary survey. Shelley Campbell and Linda Weber.
Good morning again, commissioners. Thank you for having me again today. Kathy, were you going to bring up the presentation, or should I just go over it? Is it in everybody's packet?
So it was my understanding that Linda would be here and she was going to show it. I was going to make her a co-host. If she's not and you have the presentation, let me make you a co-host.
So sorry, she is unable to make it. I just got word from her that she's unable to make it, and I do not have that with me. I have it in the packet that you guys have. So I'm
okay. Let me
that unless
give
you
me a moment to find it and bring it up for you.
So I'll just give a little introduction while you do that. Thank you, Kathy, so much. So just to let you guys know, North Central Public Health back in 2017 had done a salary survey for NCPHD compensation packages for staff. And over the past few years, there has not been movement on that salary survey for a number of reasons. And we were looking at it again this year to look again, bring our salary survey up to date and represent it to the 3 counties on where NCPHD staff compensation lies. So we contracted with One Tree Hill, Linda Weber, to look at the salary survey from 2017 and bring it up to date. So that has been done. And thank you, Kathy. And what we wanted to do is we have taken this information to the Board of Health for their review. And we've also shared it with Wasco County admin staff, as well as with Gillum County Court, and all the counties have the information. And what we want to do today is really bring it and share it with you, an informational process, just to let you know where we're at and how we want to make plans to move forward. So if we can go to the next slide, thank you. So again, we're working off the 2017 data, but we have taken all that and updated it to 2021. It provides a market range of the existing positions. So we took all the positions currently, even some of the positions that we are looking at that have been working in COVID, even though those are temporary positions. And we want to make we are making a market range recommendation and really looking at how do we how do we, as partners with NCPHD and the 3 counties, move the process forward and bringing NCPHD staff compensation up to the market rate. So our current pay system, so when NCPHD became a district, we moved over and really mirrored the compensation package that Wasco County was under. Now I know Wasco County has changed that process and done some different things. We are looking at how we change that to update to be more comparable to Wasco County as well. That was one of the recommendations, and I'll go into that in a little more detail later. Currently, we still do the 5 steps. Someone's hired, they're here for 5 years. If they're hired at step 1, each year they get a 5% increase. And then after 5 years, there is no more room for an increase unless they were to change to another position or they were to receive any kind of cost of living raise. One thing we do still have is longevity pay. There's certain amounts after 5 years, 10 years, 15 years, and 20 years that people get a longevity increase monthly. So we looked at where we're at currently and compared that, the survey compared with like positions throughout different counties within Oregon and some other data to look at where we stood. And I think people are aware, and if you've had a chance to look at the data, we are in many cases pretty significantly under market rate when it comes to like positions. One of the findings was if we have a salaried person and we have a couple that are working, unfortunately, if they are a family of 4, they also qualify for SNAP benefits. And now that's unsettling when you're working for a public agency. So what you see now is our current pay rate. So it shows all the different positions. We have classes of H, M, P, S, and you see those here. You see the 5 steps that I was talking about with the percentage of each step that goes up currently. It's anywhere from 4% to sometimes 5%. And then you see the step 5 is the maximum amount. Next slide. So the data that was used was HR Answers was contracted with in 2017 to get the information. I believe that's the same place that Wasco County had also used to do a salary survey. The counties that were compared to this year were Klickitat County, Columbia County, Hood River, and Polk County. One of the things that happened in 2017 was Deschutes County was also put in the mix, and we removed them this year because we just didn't feel like we were in the same population and process. So we pulled out Deschutes County and added Hood River because we felt like that was a closer range for us. And then the Consumer Price Index was used to look at the amount of increase each year for cost of living. So where we're at today is, in front of you now is the first draft. We looked at, in the light blue is our current ranges. The yellow, light yellow is the market average pay. And then the green is the what it would take to get, percentage-wise, to get staff to that midpoint or that market range. I'm not going to go into a lot of detail here because I want to really let you know where we're kind of moving towards. And you can look at that and certainly ask any questions if you would like. So right now, our first recommendation was, okay, how do we get more in line with our partners here in this region? And that was to go from a 5-step to either 7, 9, or 11. So our first draft was go into a 7-step program, which you see in front of you, and that changed some of the percentage of what those increases would be. And again, instead of 5 years, you max out, it'd be 7. Well, to get to that market range, as you can see, there were some fairly significant increases in some of the positions. So we're reviewing how to do that with making it more balanced moving forward, and also looking at pushing those steps out even further, maybe to 10 or 11, so that people have a longer span of being able to increase their salary. So we'll go to the next slide. So as you know, what's important is we would love to be able to bring employees up to a market minimum initially, because we do have several employees that are below even the market minimum. Our end goal would be to get people to the midpoint, but we know that's going to take several years to do that, and a good compensation plan. One thing that did come out of the salary survey, we knew this, but I'll share it with you. We have our three positions: the director position, the health officer position, and the nurse practitioner position that are static. Those three positions are hired at one rate, and they never to date have received any type of annual increase unless it's cost of living. So we would like to also then change that so they have a minimum rate and a maximum rate. So that will be part of our recommendation as well. And then again, any additional classifications to narrow steps where necessary. We're really trying to consolidate some of the positions so we don't have so many if we can. And then an annual increase of July 1st will move employees to new ranges. So this was our first initial conversation. After presenting and talking with and working with not only the Board of Health, but Wasco County administration and some of the other counties, we are moving towards another recommendation. We got some really great feedback. So we will continue to move forward and work on the salary survey. A couple items that we're working on is how do we stretch out those annual raises from 5 years or 7 years up to more like 10 or 11 years, so people have that longevity and can do that. You can move past this slide because we'll want to do at least 7 steps, but and then look at the CPI continuing that increase where it's appropriate and when it's appropriate. So again, working with Wasco County to be more in alignment with that. So we're really comparing apples with apples, and we're working to understand how to make sure our staff is brought to market range and have a very solid compensation plan and policy moving forward. And as you all know, I mean, salary is such a big piece of hiring people. It attracts certainly the right candidates, and I'm a true believer in finding that how we let people know we value them is by giving them a fair compensation. Of course, it encourages longevity and reduces staff turnover. We've been fortunate here to in most cases, to have long-term employees, but we are seeing that we are having a higher staff turnover in the last few years. And then, as you know, how expensive it is to hire and train a new staff person can be very expensive. And we certainly have seen that this year with our level of increase of staff just during the pandemic. And then helping people feel appreciated and certainly having a positive work environment. And reduce stress on staff and covering those pieces. And so really today, I wanted to just share this information with you, let you kind of mull it over, see what it is, but just to let you know that we have the data that shows where we are and where we hope to move to as we're working on that. We will continue to work on this for the next year because we did get some really good feedback, and we want to continue to make sure that we're in, as I mentioned, in alignment with that. And working with our Board of Health, we will make further recommendations, but really wanted to present with you the body of the data that supports our ongoing request and work towards changing of the salary compensation at NCPHD. I think, and I know that certainly over this last year during the pandemic, we We know how much our three counties value NCPHD staff. And we want you to know we see that, and we also want to know that we want to show our staff that they're valued by bringing their compensation level up to the same as what their colleagues and peers, not only in the three counties, may get, but also in our neighboring counties.
All right, thanks, Shelley. Questions, comments for Shelley?
Sure. Thank you, Shelley. That was an excellent report, and I really appreciate you taking the time to show us the work that I guess I will say we've been doing since I am chair of the Board of Health. And I think this today was really just a kind of an update, and just to kind of show the commissioners in the audience where we're at. I think that we have more work to do, as Shelley mentioned, this coming year. We really need to work on a comprehensive compensation policy, and we definitely need to be working with staff. They need to be coming along with us every step of the way with that. And as Shelley mentioned, I do want to thank Tyler and Mike Middleton and Nicole for really giving us a lot of technical assistance and for showing us a path forward that gets us closer to mirroring Wasco County's, not only their salary survey and how we do it here at Wasco County, but also that comprehensive compensation policy that we'll be working on. As we know, Wasco County is a significant investor in North Central Public Health District. So it's really important that we can, to the best of our ability, compare those, oranges to mangoes or something. I mean, it's probably not ever going to be a perfect comparison, but we want to get as close as we can. So again, thank you for all the technical assistance, and I hope this was informative. So.
All right, thanks, Kathy. Steve, did you have any comments, questions?
No, just as stated, that this is going to raise a lot more questions and a lot more conversation, and so looking forward to those as we move forward. Thank you.
Okay, very good. Tyler, I don't know if you had anything that you wanted to add here.
No, this is just informational, I think, at this time, and like everybody has said, we still have some work to do around this. So,
okay, very good. Shelley, did you have anything else that you needed or wanted to share with us at this point?
No, not at this point. Just thank you for having us today and listening to our presentation and being a partner in this is much appreciated.
All right, very good. Thank you, and thanks for being here. Thanks for the information. And with that, we will move on. Have a great day, Shelley.
Thank you.
All right, so we're going to circle back up a little bit. We do have a consent agenda, but before we do that, I think we'll go ahead and go to public comment. We have some folks from the public here. I don't know if anybody here has something they want to bring before the county commission. If you do, I'm going to give you an opportunity to unmute yourself and talk to us. People are leaving like crazy now. All right, couple more seconds here. Anybody that has something that they want to bring forward to the county commission, public comment, this is the time for that. You can unmute yourself and talk to us. All right, we're going to be going. All right, gone. Thank you. All right, so we did have a couple, we do have a consent agenda that we need to address. And then we also had, I think, two other items. I think Commissioner Kramer and Commissioner Schwartz both had something they wanted to kind of talk about. So why don't we start with Commissioner Schwartz?
Thank you. Let me pull this up. I think I just got this email this morning from Senator Finley. Did you both see that email this morning from him?
I saw something come in, but I did not have time to look at it.
Oh, where is it?
Yes, I got it. It's Senate Bill 154. It's on the pilot program where AOC, LOC, various CREA, other organizations got together, and the program started with a $7,000 cap, and they negotiated down to a range between. I'll back up. They wanted to start at $3,500 for that initial fee, and they've settled on the $5,500 to $7,000 range, and so that's where Senator Finley's looking for our expertise on this to see if this is acceptable for our counties, and because he does feel that the rest of the bill is worthwhile. So hopefully that gave a little bit of background, and I could probably turn to Chair Hagee to answer more specific questions on that, as he knows a little bit more than I do.
Yeah, okay. So this was essentially the discussion we had with Avangrid. I mean, in many regards, that was the same kind of as I think we talked about during that time. This was already in play and they were working on that. And so that's why the solar industry was basically encouraging this bill to, one, not get sunsetted, I think, and then also change the numbers so that because the cost of labor has gone up and the cost of the revenue that they get from the solar power has dropped. And so when you find those two together, what they were finding is this pilot program was kind of not useful anymore because they couldn't really make ends meet on a solar project. I guess that's the whole idea. So there you go. Now, I didn't see it this morning, but yes, that's Commissioner Kramer, you're exactly right. We've been through this with Brian with Avangrid, and I think it was the same basic logic behind it.
So, and if I may just add just a little bit more, basically what this does is it gives county by county the ability to do what they see works for them in their particular case. So this is a pretty good deal, and I think everybody's on board at this point.
And just to be clear, so we did not choose to do this with Avangrid for our solar project. We have a different agreement. We have the red zone, which is like this in some ways, but not like this in some ways as well.
Okay, well, that was very helpful. I really appreciate your perspectives.
So, okay. So did you have any, I guess, I'm not even sure, they're looking for input. So I guess we can all give them our input, whatever input we want to give them or not.
Yeah, I think so. Yeah, thank you. That's what I needed. Thank you.
All right, Kathy, thanks for the question. All right, Commissioner Kramer.
Yeah, and just to follow on that, I think that it would be good if Wasco County could send unanimous decision to Senator Finley. It is more advantageous for us to do it as a county than it is to do it individually. So with that, segue into
before Steve, sorry, with that, if you want, then basically all they're doing, the bill is doing, is leaving the cap or the top point at 7,000 and allowing for a reduction. And you saw that some of the folks were saying, well, we're going to leave ours at 7,000, and like, okay, we'll leave it at 7,000, but it gives an opportunity for folks to use that pilot program. And so if you're okay with it, I'll respond that Wasco County is supportive of the range and we have no issues. Okay. All right. Very good. Commissioner Kramer.
Okay, cool. That'll segue me into my next thought. It has to do about legislative issues going on, and I would like for us, the three of us, to consider taking a little bit more time out of our schedule and adding a legislative meeting or a work session or whatever you want to call it during when session is involved. I think that it would give us an opportunity to have conversations to find out what is happening in each other's worlds and how we can support or oppose or remain neutral as a county and how it affects the county. And I think that that would be very advantageous for us to do as a county. And because, you know, we all live in separate little worlds basically during this time of year. And we don't have an opportunity to get together and visit about what is happening in health and human services or what's happening in public safety, et cetera, et cetera. And so take a couple of days, think about it if you're willing to spend a little bit more time, maybe on our off weeks that we could get together and talk with our directors and find out just exactly where things are going. We will find out this Friday is basically do or die Friday for those bills that haven't had a committee or haven't had a hearing or are not being referred to rules or revenue. We're going to lose a lot of those. And so next week will be the priority time for bills to be moving forward. So take a little bit of time, think about it, and respond to Kathy Clark or Tyler with your thoughts, comments, yay, no, whatever the case may be. But I think it'd be really good for Wasco County to be signing letters that support or oppose that we're taking care of Wasco County. So think about it. It was something that I've been working on this week. And I thought that, well, I've kind of been doing it for the last couple of years, but we haven't gone anywhere with it. So I'm going to push a little harder. I would like your thoughts on that. And so with that, I'll move on to the other issue that I raised last meeting about the Second Amendment sanctuary county. I'm getting lots of requests from our constituents that we consider doing something of that nature. We have several counties around the state that have done, and we have some judges that have denied measures to go on ballots. And Ms. Campbell has been doing some research, and I've been doing some as well. At this time, we ask your indulgence to bring it back to another meeting. We do not have all the information that we would like to present to you to move forward with this. I do feel that it is an important issue. The Second Amendment is always an important issue that we all need to be aware of, and we've taken that oath of office for. And so, you know, what we need to, what we're dealing here with is now symbolic and validation from the courts before I'm willing to move forward, but taking a hard look at it. And so with that, I'll be done. Thank you.
Okay. Thanks, Steve. Any questions for Steve at this point?
I don't have a question, but Steve, did you want to talk further about the letter you mentioned to Dr. McDonald on local control of the COVID response, or did you want to not?
Now, what I did, Commissioner Schwartz, I sent it to Dr. McDonald, and I asked her for her thoughts. And so I'm I'm kind of there, I'm kind of not. I like some of the stuff in the letter and some of what she stated this morning, that some make sense, some don't. So I wanted her to see the letter and then respond to me, and then we'll, I know that there's a deadline of tomorrow on it. But at this point, I don't think we have enough information to sign as a county. And so, so I'm not going to ask you guys to do that. So,
Okay.
And actually, I don't think they were looking for that. At least as I recall, they were looking for individuals to sign it. Is that correct, Steve?
They were taking individuals and commissions as well. So either way, Klamath County decided that all three of their commissioners decided they wanted to sign it as a county. So so there was an option, but like I said, there's still it just came really quick, and not a good enough turnaround for us to have a conversation about it, because there could be some fiscal, there could be, you know, and so I want to make sure that we're doing the right thing as we look after our constituents. So,
all right, thank you. Anything else, Kathy?
Yeah, I think just to help out a little bit with that topic, you know, not to go into a lot of detail, but I did see the letter, and I did have some, you know, some thoughts that you know, probably draw from my many years in public health, that if it helps the two of you at all, decide how you want to go with that. You know, I think Mimi alluded to this morning that she, you know, part of what OHA is providing for locals is really doing all that research and tracking all of what's coming out of CDC and the World Health Organization and pumping that to our local health officers directly, which allows Mimi to, you know, be busy with getting clinics going and on the groundwork. And one other really important thing that I think is important to know if you don't know this is that health officers are not epidemiologists. And so they are not trained necessarily in epidemiology. Many of them come from different disciplines and they study public health, and they certainly get a great, as you can tell, a great understanding, but they aren't physician trained epidemiologists. And so that's what we have at OHA and at CDC that is actually, you know, doing this guidance. So I think that's a really important, and even in the larger counties, and again, I'm drawing on years ago, but even in Multnomah and Clackamas County, the health officers were family practice general doctors that were not trained epis. And that's where, you know, the state actually has trained epidemiologists. So I wanted to just put that out there for you. I think that's an important point to understand. So thank you for that time.
All right, very good. I've actually taught 2 epis to ski this year that work for the Oregon Health Authority. All right, with that, I think we're going to go ahead and move to our executive session. Is everybody good with that?
Did we do minutes? Did we have?
We actually did not.
Consent agenda.
Consent agenda, thank you.
I thought I heard her motion. I'll second.
All right, we have a motion to approve the consent agenda for 3/3/20, or the minutes that include minutes for March 3rd. And that's the only thing in there. Any discussion? All those in favor say aye.
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 All right, unanimous. The consent agenda is done. So all of our items are done. And with that, we will go ahead and move into executive session. The Wasco County Board of Commissioners will now meet in executive session pursuant to ORS 192-662H. So with counsel concerning the legal rights and duties of a public body with regard to current litigation or litigation likely to be filed. ORS 192-662F to consider information or records that are exempt by law from public inspection, and ORS 192-662D labor negotiator consultations. This executive session will be held in a separate virtual meeting room. Representatives of the news media and designated staff shall be allowed to attend the executive session in a separate virtual room. All other members of the audience will remain in the main meeting room here. Representatives of the news media are specifically directed not to report on any of the deliberations during the executive session, except to state the general subject of the session as previously announced. No decisions may be made in executive session. At the end of executive session, we will return to the open session in the regular session virtual meeting room right here. The first item to be discussed in executive session today involves labor negotiations, which are exempt from media observation. Media will be invited to join the executive session at the conclusion of that discussion. So with that, take us away, Kathy.
Okay, be patient with me. This is going to be a lot of back and forth, and I haven't done that before. So
You're going to do awesome.
Hold on to your seats.
All right, so we are back from executive session and waiting for everybody to join us here. As soon as Kathy Clerk gives me the all clear sign, we can resume our regular session for the Wasco County Board of
The
Commissioners.
breakout room doesn't exist, so everybody was automatically thrown back into this room. So you
All
should
right.
be good to go.
Very good. Okay, so we had, I think we had 2 items in executive session that need to be addressed in regular session. So commissioners, would you like to proceed?
Thank you, Chair Hagee. The first piece that we had this morning was a grievance, and I would like to move that we deny the grievance and direct staff to follow Oregon statute.
I'll second that.
All right, so we have a motion and a second. Any discussion? If no discussion, all those in favor say aye.
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 Chair votes yes. All right, thank you very much. We had one more item.
Yes, and on the second item, we heard a request for leave without pay. And to that, I would like to move to approve employee request for leave without pay.
I will second that.
All right, we have another motion and a second. Any discussion? All those in favor say aye.
Aye.
And chair votes yes. Nice job, commissioners. All right, those are all the things from executive session that we had to deal with. And so we're back in regular session. The only item left on here is, let me ask quickly, is there any other public comment at this point in time? There is, don't really see much public. There's media here. Thanks for being here. Appreciate that. We will go to commission call then. Commissioners, do you have anything exciting for us?
Yeah, we've got a salvage logging project going on the White River. I think that's going to be finalized here pretty soon, and I am going to ask my co-convener and my facilitator for us to put a presentation together for my 2 colleagues and our constituents at a future date so that we can bring you all up what's happening in our Force Collaborative.
Excellent. I told Steve I work with this guy. I didn't know he was our facilitator, but I work with him up at Mountain Meadows, and we had a chat the other day as we were both working the same shift. So I look forward to hearing from you both. So, and just, just following along down in Salem, like I said earlier, that Fridays basically do or die for the bills. And so looking forward to early next week to see what is there and how they all are going to affect us in Wasco County. So I'll stay on. Thanks, Steve. Kathy?
I don't have anything really. I just had more of a question. I guess Congressman Bentz is scheduling calls with us. I don't know if you guys have had your call already, but is there any kind of unified message or priorities that you would, I still have to have my call that you would like me to put forward, or I don't know. I don't really know the. Go ahead. That was my commission call. Oh, sorry. No, that's fine. So, and just so you know, the reason why, and I didn't really know this, but basically, I think Congressman Benz's office, Congressman Benz specifically, as well as his staff, are just really doing an introductory call to say, hi, this is me, this is all my staff, this is the roles they're going to play. Here's the contact information for everybody. It's really just to kind of kick things off. I mean, they did say, they asked me kind of what federal issues I might have on my mind. And so they'll probably ask you the same thing as well. Just for your information, I told them, because usually my most frustrating situation is with the Gorge Commission.
and the fact that they started the act back in Washington, D.C. I said, it's still your problem and it's still a problem for us, and I'm frustrated. So, but there's really no, that was all it was. Then I talked about forest policy, the same thing about that I've talked about all the time, that we talk about all the time, that, we have a renewable resource. I just want to be able to, get in there and effectively use it. And, I don't like begging for SRS dollars to help keep our roads maintained. I'd just as soon get our cut of the timber cut if we can get back to a more reasonable situation. So that was me. So, and I think it was admirable of them to reach out and do that it was the congressman himself too. So that's great.
Mm-hmm.
So.
And Congressman Bentz is very educated in water issues, and along with what Scott commented on, I will be asking about the wild and scenic designations that we've been seeing here in the last couple of months. So I will be asking questions about that, and how, if passed, is that going to affect our landowners, because they're potentially going to lose another 1/4 of a mile of their ground, and what that does to the fire control efforts in these canyons, and et cetera. So there you have kind of what we will be visiting with him about. And I was scheduled for this afternoon, but I've got some change in plans, and I will meet with him on Friday morning. So thank you.
Okay.
And that's a heads up to you, Kathy. He's right after your call. So they'll probably want to stop you cold at 9 o'clock.
It was pretty clear that they had some hard finishes on meetings. So, but that's fine. I had plenty of time, but I think you have an opportunity to bring up those issues. And now that Steve mentioned something, the outreach team goes back to DC, and because it's March, this is normally when we have one of our 2 visits, and I'm getting appointments that we actually have. We are starting a virtual outreach team visit, so we will be meeting with Congressman Bentz as well as the senators and their staffs on both sides of the river over the next couple of weeks. So, and really, like the 2 things that I generally bring forward from the county are forest, SRS, as well as some Q-Life things related to Cascadia and preparation and all that kind of stuff. So I'll make sure that you get the book. The book is basically the same. I don't think anything's changed, but those are the issues, the federal issues we're pushing forward. But if you have something else federally that you want me to bring up, now's an opportune time to do that.
Okay, I'll give that some thought. Thank you.
I'm assuming there could be some housing stuff, for example.
Yeah, I'll give that some more thought. I appreciate that. I didn't really think about the timeline of that outreach, and it just, the year went by pretty fast, didn't it? Pretty,
yeah, it did.
Sidetracked for sure. Yeah, I had something else, but I think it's kind of slipped my mind here. So I guess that's it. And unless I think of it in the next 5 seconds. So
yes, Karen.
Well, I'll talk a little more so you can remember. Now that you brought up the outreach team, thank you, Scott. We didn't discuss the mental health side of things when we were back there, when I was fortunate enough to go, but I think that's a big piece that we need to be putting in somewhere, because it's going to be a big issue. Thank you.
Yeah, I agree, Steve. If you know of anything that, like, for example, could be sources of funding or bills that are back there that could potentially we're pushing for, those are the kind of things, obviously, that it's good to bring forward. We can talk about it in a generic fashion, which is totally fine. But if there's specific things that we want help with, then that's usually more effective.
I'll reach out to Lizzie at AOC with the Health and Human Services and find out what it is that we're all working on. So thank you.
Okay. And Tyler just sent me a text of something he wanted me to look into Lockheed Martin property. So yeah. Did you remember yet, Kathy?
I did.
Yeah.
Yay. I'm just getting some, certainly some preliminary emails, as I think all of us are, around the latest COVID relief package and dollars potentially coming directly to the county. But I don't think any of that is set in stone, or especially the, how those dollars can be used. But certainly what I'm seeing, it looked pretty significant. So
5.1 million.
Yeah, that's what I saw. And so I guess we'll be having some discussions about that soon.
I would guess so.
Yeah.
And that did come up actually with Congressman Bentz's office too, because they just wanted to make us aware that their estimate of that was that we were going to receive that amount, and had we had any thoughts about that. And it was interesting. I mean, this is obviously something we'll have to talk about, but their question was like, is that amount going to fill the holes that the counties had in the last year? And Tyler won't like, I mean, my comment was my thinking is that we really need, a lot of that's probably going to go to help our businesses. I mean, obviously we've had some challenges, but I don't think, Wasco County as an entity has not seen huge reductions of revenue from taxes or other things. I mean, from COVID related stuff. And we've had some other stuff we've had to do and some money we've had to spend. And I think we've kind of been reimbursed for a lot of that. So that's going to be a discussion. And that's a good point. I don't know when that's going to happen, but the weird thing was, it seemed like they said half of it had to be spent. It doesn't have to be spent quickly, like half of it by a certain period of time, but they were talking about 2024 or something like that. And I was just like, my thinking was like, no, we need to get this out there as quickly as possible so that people can kind of get reestablished.
Mm-hmm. Yeah. I was just, if you haven't seen it, there is a website you can go to that actually talks about all of the relief that has gone to small business or businesses in Wasco County. Have you seen that? It was like with all the PPP loans and all of the different aid. It was somewhere around $39 million into Wasco County, or into, actually it was 97058.
I have not seen that. Can you share?
Yeah.
Can you
I'll
share
send
that
you
with
that
me?
website. I'll send it to you.
Share that. Thank you.
Yeah. Yeah. And it tells you like what businesses actually got how much money. It's quite interesting.
Yeah, cool.
Yeah, I'm glad you brought up the business side of that, Scott, because now we're hearing that the state legislature wants to tax the PPP stuff that's already been distributed. So nuts going on. So.
All right, Kathy, anything else? Commission call. Okay, I think we're done. Does anybody, Angie, did you have anything for us? Thanks for being here.
Yeah, no problem. I can share with you that I'm about to click send on an email to you that I received the Gorge Commission's formal transmittal of the scenic area updates, the Gorge 2020 plan updates on Monday the 15th. And so my next step is to come before you all, find some time on an upcoming agenda to come before you all and seek direction consistent with our chapter 2 of our local ordinance. We have to seek formal direction from the board before we pursue it. So I was going to send that to you all so you have it. And if you have any questions, feel free to reach out to me directly. If you have anything that you would recommend that I include in my presentation to you all, feel free to send that to me directly and I'll do my best to address it as fully as possible. The deadline for adoption, if you all agree to have staff work on this, the deadline for adoption of local amendments will be December 10th of 2021. There's not a lot of wiggle room for seeking extensions, but we may want to try just because of our existing staff capacity constraints and other projects we have in the queue. So I'll be back with more information, but just wanted to give you a quick status update there.
Okay, thanks, Angie. Appreciate that. I just quickly, the things that I'm definitely going to want to be seeing is like what is the time frame and the costs of doing this work, and where's the revenue coming in to support that, which is, I think you already know, and I think you're going to provide. Just a second, Roger, I'll get to you in a sec. Any questions for Angie on that? Okay, Roger.
We in the media would appreciate a link to that website as well, because that's a pretty interesting information. Thank you.
The one that that Kathy mentioned?
Yeah.
Okay. Excellent. All right.
Kathy, if you want to send that link to me, I can get it out to the media and to the other commissioners.
Okay, thank you.
Everybody wants it. How'd you find it?
A citizen sent it to me.
Oh, cool. All right.
And it's great. You can just filter it by zip code. And I just did a quick look at 97058, but I'm sure there's more zip codes we could research there.
Interesting. All right. Very good. Tyler, are we good? Are everything good?
We are good.
You're a busy boy today. All right. Kristen, anything from you?
Nothing further from here.
All right. Kathy Clark.
No, I just want to go eat lunch.
Okay. And we have a work session coming up. Is that right?
We have a work session scheduled for the end of April. It will be held in the lecture hall at Columbia Gorge Community College.
Okay, so it's a while out there. I did notice that you sent a document we could edit to add topics on for that
Yes,
discussion list. I actually added one. So
I saw that someone did, but it's an anonymous list so that you guys don't violate any public meetings laws or have communications that are not legal.
Okay, so anyway, just so take the opportunity to go and put your items that you want to have a discussion list, and that'll be great. With that, I wish everybody
Chair Hagee, just one more on that work session. If you so choose to do this legislative, having visits on those, we have to make sure that we get noticed. So don't forget about that on that. So.
Okay, is that something Kathy's already sent out?
So
no.
Okay.
Yeah. So are you suggesting, Commissioner Kramer, that April the 21st isn't too late for these legislative discussions? I was thinking you needed to have something scheduled prior to that.
Yes, I am. But I don't want to take away from the actual list of the work session, because I think that those are good topics.
Correct.
But what I'm saying to my two colleagues is that next week we're going to have the list of the bills. And so I think that it's going to be really important that we take a look at how that's going to affect Wasco County, and we don't have a lot of time.
So you want to have a session next week is what you're saying?
No, I'm asking my colleagues to consider it. If they want to, then yes, we'll need to move on it. But if they're not interested, okay. But I want to give them a couple of days to think about it, and then we can move on.
Well, there's not a couple of days. I would have to get the notice out tomorrow.
Well, okay.
And Commissioner, if I may, I think if you're going to be effective in this, what Commissioner Kramer is talking about is probably a weekly meeting to be able to talk about those legislative impacts that are sitting out there. Once a month is not going to be effective for us to be able to have succinct communication and timely communication on those issues. So that's what the ask is.
Okay. All right. So that ask